Patient has had this upper denture for a number of years, and the lower teeth have some periodontal disease and some decay and some wear. You can see here on the panoramic x-ray a periapical problem with one of the incisors, and you can certainly see the calculus. A close-up shows more of the same. Calculus decay, periapical problem, bone loss. So we're not going to save those incisors, and we're going to concentrate on the canines and the 3 bicuspids. Here's the amount of space in the posterior area on the patient's, this is actually her left side, where there's just 1 bicuspid. On the other side there's 2 bicuspids. And we're going to restore her to molar occlusion with 1 implant on one side. On the left side of the screen we will put 1 implant, and then on the right side of the screen we will place 2 implants. Again, 2 implants in the number 19 and 20 area, and then 1 implant in the number 30 area. The patient has lost some vertical dimension over the years from wear on both the teeth and the denture. Here's a panoramic view, and you can see where we're going to put 1 implant in the number 30 area and then 2 implants in the 19 and 20 area. Here's the 19 and 20 areas, and we're going to put in 10.5 millimeter implants. Here's the number 30 area, and the same, we're going to put in a 10.5 millimeter length implant. So our treatment plan is going to be a new upper denture, and then on the lower we're going to remove the incisors, do an Emax fixed bridge from 21 to 29 on the natural teeth, and then crowns on the implants. Here's the treatment sequence. You can stop this and look at that if you care to. Again, here's an occlusal view. And at our first appointment, we will take out the incisors and then rough prep the remaining teeth and make a temporary bridge for that area. Here's the temporary bridge. And then at the same time at this appointment, we will place the implants and do a connective tissue graft on the right side. Here is the area on the right side, and we're beginning the flap for the implant. We're going to do a full thickness flap near the crest of the ridge, and then a partial thickness flap more towards the buccal so that we can slide in our connective tissue graft. Again, here's just a panoramic view. The close-up view of the number 30 area, which is where we are going to put an implant first. Here is the flap and the preparation for the osteotomy for the implant. And the implant size was 4.6 by 10.5 millimeters. Here's the implant in place, and you can see where I stopped the full thickness flap. And here's a further dissection of that area for the connective tissue graft. We then went to the palate to obtain the connective tissue graft. This is after the graft has been obtained and the flap has been replaced. The connective tissue graft is then placed in F3 PRGF, and then it is slipped into place, buckled to number 2829 and the implant, and then we sutured that with 6-0 polypropylene sutures. There's the sutures in place. And then we go to the other side to place 2 implants, one in the number 19 area and one in the number 20 area. We placed a smaller diameter implant in the 19 area due to the size or width of the ridge. We also took some xenograft and mixed it with our F2 PRGF and placed that buccal to the number 19 area to help augment that area. Then after that, we placed an F1 membrane, and we're starting to do that now. The F1 membrane is then tucked underneath the flap. You can see the bio-auth xenograft. And there's a xenograft in place. And we will then suture that area. Here everything is closed up, and we're ready to place our temporary bridge. Panoramic view of the implants in place, and the temporary bridge has already been cemented with a non-eugenol cement. Often I'll use clear Tempon for that procedure. Here we are 1 month later, and the temporary bridge is held up decently. Tissue is healed nicely, as you can see here. And we're going to remove the heads of the implants, refine our preparations of the natural teeth, place the abutments on the implants. Here's a 19 and 20 area. Here's the number 30 area. Tissue looks very nice for 1 month healing. The abutments are placed and torqued with the torque wrench as usual on both sides. Number 30 side. And then we start thinking about occlusal reduction and preparation of the implant abutments. We can see we need some reduction of the implant heads on this left side, and the same on the right side. The vertical looks about right there. That is her old denture, though. She hadn't committed to a new upper denture yet, and so we were handicapped there. She later did agree to do a new upper denture, so we were kind of out of phase there. Here we're using X-Sil to retract and dry up around the teeth. Everything has been prepped. We're just using a triple tray with our impression material. Impression materials in place for the final impression. Here's our final impression with yellow is the stiffer bodied silicone and the orange is the light body. The preparations for the implants were actually supragingival because we didn't feel aesthetics was a concern in that area. And then we had a impression against her old upper denture. Again, she hadn't yet started to make the new upper denture yet. Here we're getting some jaw relations with our bite registration material. And we're just looking at her vertical dimension here. I'd like to take that bite registration at their expected vertical dimension if possible. We decided between an A1 shade. Here again is the lower temporary bridge. And then that is cemented to place with non-eugenol Tempon material. Here's our final impression for our new upper denture. The patient did decide to go for the new upper denture, and so now we're starting. Here's the two upper dentures side by side, the old denture on the left, obviously, and the new one, same size, lighter in color. Here's the old denture in place, and then we're going to see in the next picture the new denture in place, new try-in. I thought these teeth were a little too light, so we decided to change that. Went to a darker shade, which I think looked a lot better. Here's the teeth on the articulator versus still the temporary teeth. We haven't quite caught up with coordination of the upper versus lower. Here's a new upper teeth, try-in, lateral smile, and I thought her vertical dimension was maybe a little full here, and so we decided to change that slightly. At our next appointment, our lower crown and bridge is done, and this is actually 3 pieces. On the number, here's the underside of it. There's a single crown on number 30, and then 19 and 20 are splinted together, and the rest of the anterior teeth are splinted also. And these are Emax crowns and bridges. Now we're going to do a try-in versus the upper teeth, which are in wax, and we're going to take some jaw relations then, because obviously our bite isn't quite the way we want it yet. So we're going to do some jaw relations and then see her at the next appointment to put everything in place. The teeth on the left side, her left side, were just a little bit too long, and so we decided to adjust that also. Here we've marked those teeth and just recontoured the length of those teeth, and that looked better aesthetically. Here's our jaw relations, and then we're sending everything back to the lab. But here's a picture first before that, and I think our vertical's where we want it now, and I think our shade is better, and she's pretty happy with how things look, and so are we. So next time we'll deliver the case. And this is our next appointment, and today we have the lower finished. And again, these are 3 pieces, 1 single crown on number 30, 2 splinted crowns on 19 and 20, and the rest are splinted together. Number 30 is in place, and so is 19 and 20. And now we're going to try in the anterior segment. And first check the contacts between the 2 segments and adjust accordingly. Then we take it to the model and also adjust it there too, with final adjustments in the mouth. Interproximal contacts are usually adjusted with a fine diamond in a high speed and then polished. Here's the lower arch ready to cement. Things have been adjusted and polished, and we're going to use DC Bond for the final cement. The bonding liquid of DC Bond is a self-etching liquid, and the resin cement is a dual cure resin cement. Now we're going to go up to the upper and seat the upper, and first we use pressure indicator paste to see any pressure spots initially, and we might do some light adjustment if the patient feels this pressure, feels any soreness. We can adjust this at this time. Here's the other side, and there might be some slight pressure areas, but if the patient doesn't complain, I usually don't adjust them. Here we're adjusting one spot where there was some slight pressure and the patient thought it might get sore. Then we'll check the occlusion with just a preliminary check. I will also adjust the posterior palatal seal if it feels too long or if there's excessive gagging for the patient. Now I'm refining the occlusion and bringing more teeth into occlusion, making sure we have even balanced occlusion, and then we'll let her take the dentures home and then refine the occlusion again at the next appointment. And here is the case delivered. Here's a frontal view, and here's a view of, actually this is her left side in the mirror, and here's the occlusion on the right side, also in a mirror, and here's our patient finished with a nice smile, and she's very happy. Here we are 18 months later at a hygiene appointment. Patient has done a wonderful job keeping her mouth clean. as you can see, and the tissue looks great from all angles, and she's enjoying her new teeth and really very happy she went through with the procedure. So this is Dr. Paul Cozy. I hope you enjoyed this case. So I'll see you soon, I hope. Thanks to Dental XP.